Hi, my name's Breanna. I'm going to be your nurse today, and I'm going to be performing a full head-to-toe assessment. First, I'm going to ensure that I have the adequate equipment. I have my stethoscope, my pen light, I have soap to wash my hands, and I have gloves to ensure adequate infection control. I'm going to wash my hands now. Are you wearing any assistive devices today?
No.
Okay, and are you in any pain?
No.
All right, perfect. Can you tell me your name?
Melissa.
And what day it is?
Saturday.
And where you are?
The hospital.
Okay, patient is alert and oriented ×3. Speech is normal, not slurred. I'm going to tell you 3 words, and I'm going to ask you to remember them until the end of this assessment. The words are moose, car, and purple. Okay? Now I'm going to assess your cranial nerve function. If you could please smile and frown, puff your cheeks, and raise your eyebrows. Cranial nerves are intact and functioning properly. Now can I have you touch each finger to your thumb on each hand? Okay, patient has adequate fine motor function. And now I'm going to have you stand up. I'm going to touch 5 spots on your body. I'm going to ask you to close your eyes and tell me what areas of your body I'm touching.
Right shoulder. Left leg. Left foot. Right hand. Head.
Okay, patient can identify sensation in the upper and lower extremities. Now I'm going to just have you stand straight. Posture is erect. And now I'm going to have you walk to the door and back. Patient has normal gait, no shuffling or abnormal gait. Noted. I'm going to have you now close your eyes and reach your hands out in front of you. This is, okay, patient successfully completes the Romberg test. You can open your eyes now and stand on one foot, and now switch to the opposite foot. Okay, patient has adequate balance. Now I'm going to have you turn around, and if you could lean forward for me. No palpable lesions or masses in the spine. The spine appears to be in good alignment. No kyphosis, lordosis, or scoliosis noted. Okay, now I'm going to do the range of motion in your upper extremities. If you could please move your arm in a circular motion. No signs of crepitus. Now I'm going to have you bend and extend your elbow. No signs of crepitus. And now I'm going to have you circle your wrist. No signs of crepitus. Were you in any pain in that extremity? Now I'm going to have you do the same for the opposite side. No signs of crepitus in the shoulder. No signs of crepitus in the elbow. And no signs of crepitus in the wrist. Did you feel any pain in that extremity? No. Okay, now skin of the upper extremities is warm, pink, and dry. I'm going to assess the capillary refill. Capillary refill is less than 3 seconds. Skin turgor is adequate, no tenting, which indicates adequate hydration. And capillary refill on the opposite side is less than 3 seconds, and skin turgor is adequate with no tenting. I'm now going to assess the range of motion in your lower extremities. Can I have you please lift your leg? No signs of crepitus. I'm going to have you bend and extend your knee. No signs of crepitus. And I'm going to have you circle your foot. No signs of crepitus there. Were you in any pain in that extremity?
No pain.
Do the same with the opposite side. Okay, no signs of crepitus. No signs of crepitus. And no signs of crepitus in the ankle. And now I'm going to assess your skin of your lower extremities. So the skin is pink, dry, and warm to the touch. Capillary refills of the toes is less than 3 seconds bilaterally, and skin turgor is adequate bilaterally. I'm now going to assess the strength of your upper extremities. If I could have you put your arm out straight. Now can you push up against my hands and down? I'm going to do the same for the opposite side. Push up against my hands and down. Okay, strength in the upper extremities is adequate, 5+. I'm going to now assess the strength in your lower extremities. If you could sit for me. Okay, can you lift your leg out straight and push up against my hands and down against my hands. Do the same with the opposite side. Up against, down. Okay, strength in the lower extremities is adequate, 5+. I'm now going to assess your pulses. If you could lift your arms for me. Radial pulses are 2+ in strength and equal bilaterally. Dorsalis pedis pulses are 2+ in strength and equal bilaterally. And the posterior tibialis pulses are 2+ in strength and equal bilaterally. And now I'm going to assess your head and neck. So your head is midline as well as your neck. The head is of appropriate size to the body. The trachea is midline. Now can I have you swallow? Thyroid is not palpable. The trachea has no deviation. Now I'm going to palpate your neck for any tenderness, so let me know if you feel any pain. No pain?
No pain.
Okay, there are no palpable lymph nodes indicating no infection. Now I'm going to put on gloves before I assess your scalp and hair. Okay, there are no palpable lesions or masses of the scalp. The hair is distributed equally. It is of good texture and color, and there are no signs of critters in the hair. Now I'm going to remove my gloves and perform adequate hand hygiene. Okay, I'm now going to assess your temporomandibular joint. If you could open and close your jaw for me, and move your jaw from side to side. Okay, perfect. No signs of crepitus. I'm now going to palpate your sinuses. Let me know if you feel any pain or pressure. No pain or pressure?
Nope.
Okay, perfect. I'm now going to test the range of motion in your neck. You could lift your head for me, and now pull your chin into your chest. Turn your head to the left and to the right. Okay, patient performs adequate range of motion in the neck. Did you experience any pain?
Nope.
Okay, good. Now I'm going to have you raise your shoulders for me. Okay, spinal accessory nerve is intact and functioning properly. I'm now going to assess your ears. I'm going to move your hair behind. I'm going to palpate your ears. There are no nodules present in the ears. Now I'm going to use my pen light to look into the ears. No visible lesions or discharge noted. Do you have any trouble with hearing?
No.
No lesions or discharge noted from the opposite ear either. Now I'm going to perform a whisper test. So I'm going to whisper one word into each ear and have you repeat the word back to me.
Banana. Monkey.
Okay, patient is able to identify the words whispered and repeat them back to me. I'm now going to assess your eyes. Are you having any difficulties with vision?
No.
Okay. Your eyes, your sclera appear white, no signs of jaundice. The irises are of a hazel color. And I'm now going to look at your conjunctiva. The conjunctiva are pink, no signs of discharge. The corneas are clear. Now I'm going to test your accommodation. You could follow this pen with your eyes. Pupils accommodate well. Now I'm going to test your consensual response to light. Pupils are equally responsive to light and respond consensually as well. And now I'm going to test your peripheral vision, so let me know when you can see my fingers.
Now.
Okay, patient has adequate peripheral vision. Now, your eyelashes and your eyebrow hair are equally distributed, and your eyes are of equal size and proper positioning on the face. Now going to assess your nose. Can I have you cover one nostril and blow out? And I'm going to have you do the same with the other. The nares are patent. The nose is of adequate size and proper positioning on the face. Now I'm going to look up into your nose with the pen light. Okay. No septal deviation present, no lesions or discharge noted. Or have you been having any difficulties with smelling lately?
No.
Okay, good. Now I'm going to assess your mouth. Can I have you, your lips are pink and of equal or adequate size and proper proportion to the body and a proper alignment on the face. I'm going to have you open your mouth and say ah. Uvula is midline. Mucosal membranes are pink, moist, pink and moist. The teeth look clean, no signs of cavities or plaque present. There's no malodor, and have you been having any difficulties with taste lately?
No.
Okay, perfect. I'm now going to assess your pericardium. I'm going to listen to your heart sounds. I'm going to listen to your S1 sound at the fifth left intercostal space of the clavicular line. Now I'm going to listen to your S2 sound at the second intercostal space. Heart rate and rhythm is normal. I'm now going to assess your carotid pulses. Carotid pulses are equal and 2+ in strength. I'm now going to auscultate your carotid pulses. Auscultation of the carotid pulses was normal, no bruits or whooshing sounds present. Can I actually have you swallow for me? Have you been having any difficulties with swallowing?
No.
Okay, perfect. So patient has the adequate ability for swallowing. Your precardium or chest is of adequate size. There are no abnormalities of skin. Skin is pink, warm, and dry. I'm now going to assess your lungs. If I could have you stand up. Okay, turn around. I'm going to have you take a deep breath in and out. Lungs expand equally bilaterally. I'm now going to listen to your lung sounds. If you could take in a deep breath and then let it out each time I lay my stethoscope on your back, please. All right, I'm going to have you turn around and do the same. Okay, lung sounds are clear and equal bilaterally. Patient had no difficulty on inspiration or expiration, and there's no signs of barrel chest. I'm now going to assess your abdomen. If I could have you lay down on the couch for me. I'm actually going to ask you to recall the 3 words that I said to you at the beginning.
Moose, car, and purple.
Okay, perfect. I'm going to auscultate for abdominal and vascular sounds in the abdomen. I'm going to listen to bowel sounds in all 4 quadrants. Bowel sounds were present in all 4 quadrants, and I'm now going to auscultate for vascular sounds. Okay, vascular sounds of the aorta and renal arteries are normal, no bruits or whooshing sounds present. I'm going to palpate your abdomen and let me know if you're feeling any tenderness. Any pain here?
No.
Here?
No.
Here?
No.
Or here?
No.
Okay, and the abdomen is normal, no distension noted. Skin is pink, dry, and moist. Do you have any questions for me today?
No, I did not.
Okay, this assessment is complete. Thank you.